Here are some notes on general versus neuraxial anesthesia for C-sections. This kind of shows the pros and cons of each and when each are appropriate. General anesthesia should be used when you have a relative or absolute contraindication to neuraxial anesthesia. Neuraxial anesthesia can be epidurals and or spinal anesthesia. General anesthesia should also be used if you have an emergency C-section where there's insufficient time for neuraxial anesthesia. If you expect massive hemorrhage or very complex surgery, you should also do general. If you've tried neuraxial placement and you've failed, or if the patient refuses neuraxial, then you should also do general anesthesia. Neuraxial anesthesia has some benefits. If the patient wants to be awake and present for delivery, you should do neuraxial. If you want to avoid airway instrumentation, this is beneficial in the pregnancy state because there's oropharyngeal swelling and it makes intubation very difficult. Neuraxial is associated with less postpartum depression and it also has less blood loss. There's also less VTE, venous thromboembolisms, and SSI, surgical site infections, than general anesthesia. Lastly, neuraxial anesthesia has less systemic medications, which means less drugs go to the fetus.